Are you having gallbladder issues? Let's talk about that. Hello and welcome to another edition of the Ask Dr. Pickel show. And today we are going to talk about gallbladder problems, gallbladder issues. So if you've been diagnosed with a gallbladder problem or you feel some discomfort, you think, gosh, is it my gallbladder? Or you're having certain symptoms that somebody else says, hey, maybe it's your gallbladder. Let's dive into that and find out more about this mysterious, potentially are thought to be disposable organ in our body. All right, so at the top of the list, we have gallstones, and you've probably heard of gallstones, and the medical term for that, of course, is cholelithiasis. So again, this is gallstones, and gallstones, when they form, you may go to the doctor and he may say, hey, you've got some gallstones. Well, the question is never asked why, what caused those? Because sometimes they'll say, oh, it just happens in some people, or it happens in a lot of people. You just get your gallbladder removed. Well, is that really the whole truth? Is that the whole picture? Because otherwise, everybody would have them and everybody would need to get their gallbladder removed. So why doesn't everybody have them? This is usually due to a malfunction. Something's going wrong that's allowing this stone formation. The problem is if you get some stone formation, is it a problem? Is it not? Do you need to get your gallbladder out? Do you not? Let's get into more of that, because stones definitely can be a problem, but and then also sometimes they even say sludge in your gallbladder, or your gallbladder is thickened, or things like that, which usually means it's inflamed. So there's all these potentials, but yeah, the gallstones, and a lot of times gallstones are asymptomatic. A lot of times people don't even realize they have gallstones until they reach a certain size, or until their gallbladder gets inflamed or something else happens. And every once in a while, what a person with gallstones may notice is they eat some foods with fatty foods or oils, and suddenly, every time I eat that, it gives me some stomach pain, stomach ache. And sometimes that stomach pain will be in that right upper quadrant. That's where that gallbladder is located. In fact, let's go over to this drawing here. All right. And so we have the liver right here. And of course, liver is important because that's actually where bile is manufactured. Bile is a combination of some salts and some dead red blood cells, and some other things that come in there, even some toxic materials that all combine together because your body wants to get rid of this stuff. The neat part about it is at the same time it releases things through the bile. Bile helps to break down fats and oils so we can actually digest and absorb them. So there's kind of a twofold story to bile. We need it for different reasons. Now, of course, here's our gallbladder, this little green thing down here at the bottom, and it's not that big. But what happens is our liver sends bile down through this hepatic duct called the common hepatic duct. And then it can store that extra bile in that gallbladder, which is important. We need to store some because we're eating. We need that extra bile to use to break down those fats and oils. And then it gets released through the common bile duct. And then, of course, to get from the gallbladder to this bile duct, it's got to go through this other little duct called the cystic duct. So all these little ducts that need to be working properly need to be patent so this bile can travel through them. And then, of course, what's at the bottom of this? Where does all this go? It dumps down into your small intestine, where your food is being actually digested and absorbed. So very important that this is all working properly. So if you get a gallstone in here, you can't release that bile properly, and then those fats can actually irritate. Or if the gallbladder contracts and there's something in there, or the gallbladder is inflamed, then that could also cause some pain. Now, a lot of times when people get gallbladder pain, they'll feel it into their shoulder, especially the right side, the shoulder blade, back kind of between the shoulder blades, even up into the neck. The reason why you'll feel it in these areas is because, and what we call that is referred pain, because it's not actually the gallbladder that hurts, it's back here. But that pain can be sent through what's called the phrenic nerve. We've actually got three nerves that go to the gallbladder. We've got the phrenic nerve, which is the sensory nerve. That's how we feel things, is through that sensory nerve. But we also have the vagus nerve, which is your parasympathetic nervous system, and then the celiac plexus, which sends more nerves there, and that's more of the sympathetic innervation. We won't get into those as much now, but definitely the phrenic nerve will sense the gallbladder having problems and then send pain signals to these areas. Now, the thing is that nerve is from nerves that come out of your neck, C3, C4, and C5, and those same nerves go to that shoulder area. So that's why it can refer pain there. So kind of an interesting little gem right there to know about. All right, so we can have the gallstones. So what happens if the gallbladder gets inflamed? They call this cholecystitis, inflammation of the gallbladder. And if that gallbladder gets inflamed enough, yeah, you can start to get not only that referred pain, but maybe pain in the upper abdomen, especially on that right side. You could potentially get a fever. This is actually increased heart rate, because some people, their heart will start to beat fast. And some people think, gosh, is my heart having problems here? Even though it's referring to the right shoulder blade, and they'll end up in the emergency room thinking they have a heart issue, when it turns out to be, hey, no, it was your gallbladder. And they're like, what? My gallbladder? And then they could have increased sweating. This usually means there's a stone caught in that cystic duct. And again, if that stone is stuck in there, nothing can get out, pressure builds up, expands that, and that's where that pain comes in. The next thing that can happen is we can get a stone in the common bile duct. So if you get a stone there, it's called colitis. So again, this can really cause about the same symptoms. It also will tend to cause more jaundice. That means kind of a yellowing of the skin, a yellowing of the eyes. Usually it'll show up in the eyes first. And then sometimes people will get kind of dark urine with this. They'll be like, gosh, my urine's like a really dark yellow or almost a brown. And then also we can get some vomiting, nausea. Also, you can have fever with this, and you can have the increased heart rate also. Another type is inflammation of the biliary tree, and that's where all of that gets inflamed, and that's called cholangitis. The whole thing is flared up. And this can be more of a potential emergency where, hey, yeah, I need to do something about this quick, when everything's inflamed. And sometimes we can find that actually the test that sometimes used is called Murphy's sign. It's pretty painful, though. It's just, hey, let's put some pressure in that upper area and see if it hurts. And if it does, hey, this might be cholangitis. But usually, again, you can get the fever, you can get the jaundice, the pain, the vomiting with this. So it can make you feel pretty lousy too. All right. So what are the symptoms to know really if it's possibly your gallbladder? Well, first of all, you might be having a lot of lower bowel gas and bloating, because again, if you're not digesting these fats properly or breaking them down, yeah, then we can start to get some effects from that affecting our digestive tract. Also, unexplained itchy skin. If you're not absorbing fats and oils, you need these oils. That's all the oils in your skin. They come from the inside out. So we can start to get that itchy skin. Also, what will happen is people say, oh gosh, every time I eat something greasy or fatty, it bothers me. Absolutely. And then reddened skin on the palms. Yeah, kind of an interesting sign. The palms will look real red compared to the rest of the skin. A bitter metallic taste in the mouth. A lot of times this will be in the morning where you wake up and it's like, oh, I taste like metal in my mouth. Another just sign of potentially of gallbladder issues. Burpy, fishy taste after fish oil. People take fish oil. They'll be like, oh, I burp it up. I can taste it in my mouth. Yuck. But that's because you're not breaking it down. You're not digesting those fats. So they're just setting in your gut, and then, of course, comes back up. Yellow cast to the eyes, that's when you can start to get that jaundice in the eyes. Dry or flaky skin, again, you're not absorbing the fats and oils. Like, why is my skin always so dry? I got to use all this lotion, drink all this water. Difficulty losing weight. Yeah, we need these fatty acids for certain processes. And if you're not absorbing them or breaking them down, yeah, that can actually cause you to gain weight. Stomach upset after eating. Yeah, kind of the things we've taught is like, I just ate that meal. Stools float. If you're not digesting these fats, they're ending up in the toilet. And if they're in your bowel movements, yeah, the stools will float rather than sink. not a good thing. The stools can turn to more of a clay color because of the bile in them, or because of the fats in them and lack of bile. Actually, bile can help to darken our stool. Right upper quadrant discomfort, that's kind of right under that rib on the right side. That's where that liver is. That's where that gallbladder lives. And then, of course, like we talked about, the right shoulder, upper back pain that can be that referred pain. All right. So, what do we do about this? So, number one, I would say a big factor in having gallbladder issues is, yeah, sugars and grains, these pro and refined sugars, refined grains, these processed foods. These put a lot of pressure on the gallbladder. Not only that, but these are pro inflammatory foods. When you eat these foods, it's like pouring gas on a fire in your gut, and it starts to inflame your organs. Not a good thing. And not only inflammation, but oxidation. So just bad stuff overall. So if you eat a lot of fast food or you love the sweets, you could be setting yourself up. Also, if you have these issues, and again, even if, let's say, you went in and the doctor said, "Oh, let's get your gallbladder out, take it out," and even if you get your gallbladder taken out, is that going to solve all your problems? Because a lot of times, if a person has chronic issues or chronic stomach issues or things like that, they'll say, "Well, we think it might be your gallbladder. It doesn't look too bad, but it's got some sludge or it's got some small stones. Let's get it taken out." Well, they're just hoping that that will help. It doesn't mean that they found that it was the true cause. Now, if they go in there and they say, "Yeah, there's a massive stone in there and this and that," then yeah, maybe that is a factor. Now, if you get your gallbladder removed, now your cystic duct becomes your gallbladder and it doesn't regulate bile very well at all on its own. But the issue is, though, is it's never asked, why does this occur? Why did this occur, doc? Why did this occur to the surgeon? They'll say, "Well, it just happened." Well, no. I mean, look at these things. If you have chronic gut and stomach issues, if you're like, "Yeah, I've always just kind of had stomach issues," or "I always have a bowel movement right after I eat," or "I feel bloated," or these, yeah, this could end up causing gallbladder issues. You're just, that inflammation is spreading to these other areas. Also, if you have a liver or toxin issue, a lot of toxins exit through the liver, and not only toxins, but excess estrogens, hormones, things like that too. Any chemicals exit through the liver. And if that liver is toxic, it will malfunction. Or if the liver's fatty or other issues, yeah, this can be a problem. So you've got to also deal with the liver and find out what's going on there. And then some things you can potentially do. These are all different types of herbs, supplements that can help the liver, help the gallbladder. And sometimes you'll find combinations of these together. Choline can be a great one, dandelion extract. Milk thistle, very well known. In fact, we've got a video on that. Ginger, we just did a video recently on that. So watch those. Beet powder, ox bile. Yeah, that's bile from an ox. To break things down, artichoke extract. And here's a very interesting one, green tea. So what the heck, green tea helps with this stuff? Yeah, absolutely. In fact, let's pull up a study on that. Look at this study. Tea drinking, which they use green tea. They took about 1,000 people and did this test, and they said tea drinking and the risk of biliary tract cancer and stones. So not just stones, but cancer. And in this study, they find out, hey, people are getting better. Not only did they drinking the green tea because it contains what's called EGCG, which is a polyphenol, and this actually works as an antioxidant, anti-inflammatory. This helps lower the risk of stones, helps lower the risk of biliary cancer. Biliary means gallbladder, bile duct, kind of that whole combination of that whole area there. So it's lowering this risk in a big way. And so drinking really daily some green tea can be so beneficial. So some really neat stuff with the gallbladder, but it's finding out, hey, if you got a gallbladder, number one, why did it occur? If you got a gallbladder issue, why did it occur in the first place? What kind of help does it need? And even if you do get it removed, did that really solve the underlying problem? So, all right, well, hopefully that helps. Now, I would also say if you don't have a gallbladder, like I said, your cystic duct is the gallbladder, and that also may need some help to release bile properly. And there's ways that really with those supplements I talked about that can help with that too. All right. Well, hopefully everybody got some great information out of this. Have a wonderful day and God bless. I'll see you on the next video.